stroke scale severity, this is what we were talking about. A score of 0 usually means that there is no stroke-like symptoms. A score of 1 to 4 means that that patient's having a minor stroke. This is why our initial NIH is very important, because our physicians can predict, depending on our NIH score, if the candidate is even a candidate for TPA or not. Typically, a score of less than 2, the patient's symptoms are so minor that the risk of giving TPA is greater than actually the effects of the stroke. A moderate stroke is 5 to 15, moderate to severe is 16 to 20, and a severe stroke is 21 to 42. Again, if a score is greater than 22 on the NIH stroke scale, usually that patient is ruled out of having a stroke, of being a candidate for TPA, because the blockage in the brain where the blood is flowing is too high and they're not going to benefit from TPA. So just things to remember. The first question that we asked on our NIH scale, this first question is A, B, and C, so we'll go through each of them. We're going to look for the patient's level of consciousness. Are they alert? Are they awake? Are they like us? They're talking. That would be a score of 0. A score of 1, and they're kind of groggy. They're almost in that sleepy stage, but as soon as you start talking to them or stimulate them, they're awake, they're talking to you, they're responding. 2 is they're not alert, they're not awake. You're doing that sternal rub, you're doing that pinching, you're doing whatever you can to get them to wake up, and as soon as you stop what you're doing, they go right back to sleep again. A score of 3 means that they respond to only reflexive motor or autonomic effects. That could be that they're posturing, that they're rigid, that they're just doing nothing that corresponds to what you're asking them to do. They have this spontaneous movement, jerking, whatever it may be. That would be a score of 3. We want to make sure that we only give a score of 3 if the patient makes absolutely no movement at all, or again, if they make that posturing movement. Other than that, they should be getting a score of 0, 1, 2, or 3. Question 1B, again, with level of consciousness. We're asking them questions. Can they answer both questions correctly? Can they answer only one? Or do they not answer any of your questions correct? Questions that we typically ask are standard. What month are we in? What is your age? There is no partial credit for being close. It's either you get it or you don't. And again, it's also important that only the initial answer that they give you is the one that you go with. Again, we don't want to be prompting our patients or helping them, giving them clues. It's based on what they're doing. We want to make sure that our aphasic or stuporous patients who do not comprehend questions always receive a score of 2. They can't answer any questions correctly. Patients who are unable to speak due to endotracheal tubes, some kind of intubation, trauma to their face, trauma to their airway, their mouth, whatever it may be, or any problem that is that is not secondary to aphasia, should receive a score of 1. Does that make sense? So maybe they have a tube in, they may be shaking their head for you, they have no reason that they can't talk other than something's blocking their airway, then they still get a score of 1. The third one for this question of level of consciousness. Can they perform tasks correctly? And again, it's scored 0, 1, and 2. Tasks that we have them do is we have them open their eyes really big and then scrunch them shut. And then the next thing we do for motor is we have them squeeze and release. It's very important that the patient is following the commands with the release part, because we know that squeezing something is a reflex and babies can do it. But the important part of that one is they have to be able to open their hands on commands. That release is very important. Credit is given to that patient to perform both tasks correctly if they're just too weak or that have that plasticity. If they're trying to squeeze your hands but just aren't strong, they made an attempt to, so that means that both of those tasks are correct. And the patient is not docked, no points are removed if that patient has an amputation or something to one of their extremities. They would receive a score of 0 for full credit. We also want to look at their eyes, and we're looking for the best gaze. Is their gaze normal? Is it forward? Are they able to track you? Are they able to follow you? Or do they have some kind of deviation? With this deviation, we focus on, there might be deviation, but if you're asking them, follow my finger, they can overcome that deviation. That's what that score of 1 is. They're deviating to the right, but when you ask them to track you in all of your cranial nerve fields, they can. So that's what you want in that score of 1. That score of 2 means that it's total paralysis. That eyes are to the right, to the left, disconjugate whatever direction they may be, and they cannot correct it on their own. Again, we're testing this best gaze, again, by using their cranial nerves. We're going to look at cranial nerves 3, 4, and 6, and those are all of our extraocular movement fields with our cranial nerves. If the patient is blind, we want to test their reflexes by looking at their corneal reflex or their blink reflex. Just because a patient is blind, they should still be able to respond to the corneal reflex, and we can touch their eye with that cotton ball, cotton swab, something like that, and they should be able to blink for it. Vision. Again, we're looking for visual loss. Do they have partial vision loss, complete vision loss, or bilateral vision loss? Again, we're going to test all 4 quadrants of their vision using the confrontational test. The confrontational test, do we know how to do that? Do we go over? So confrontational test is you as an examiner cover one eye, that patient covers the same eye, and then you're coming in and you're testing their peripheral vision from the different fields, and then you switch eyes again, same thing, you're testing their vision from the other field.